Getting dental implants in Mexico can feel overwhelming. So many questions, so much conflicting info. That's why we're bringing in expert dentists from across Mexico to answer 10 of the most common questions in record time. Let's go.
Here we charge half or less than half that what they charge in the US, so that's a big thing. At least 50%, if not to say up to 75 sometimes.
Postgraduate, I did in Harvard. I did implants for 30 years.
I have 15 years as a dentist and still counting.
I have 10 years of experience in the work. My procedure favorite is the surgery, implants, bone graft, all form, and extraction.
First thing that you feel something that is like your natural tooth, and then the patient is able to eat much more easy. You recover the static, the functionality, and the phonation and the diction for the patients. There are many patients that tells me after I do the implants, I can speak again. I used to, when I was 20 years old, that's the first thing that you get after to get the implants, the patients. And then the security that you get, because when you are eating or maybe you are speaking, you know that nothing will fall it. That's something amazing because the patients start to feel more sure about everything from him, for themselves. That's why the implants is changing the life of the patients.
The process that only for is make an extraction, multiple extractions, alveoloplasty with a bone graft with plasma. In case the bone is good, I can put the implant in the same appointment. After the 3 months, maybe 4 months, the patient comes for the rehabilitation.
We place the implant, and then there's time for so-called osseointegration. In most of the cases, means you have to wait until the bone connects with the implant. And that is between 3 and 4 months, depending on the jaw. But in the meantime, we provide you, if you want with a denture, something that you don't run around with no teeth. Patients, for example, with periodontitis, patients with diabetes, patients that are smokers. There's multiple things that can definitely interfere or affect the outcome of an implant, but it doesn't fully necessarily mean that they're not candidates. A patient that is not a candidate for implants is basically a patient that there's not enough bone structure, not even to reconstruct the bone in order to place the implants. And even for those patients, there's options. You have pterygoid implants, you got zygomatic implants. Implantology is a very established science, and it exists for like 30-40 years, and the problems, they are by the time less and less. It has very little risks. In the worst case scenario, if you don't know, you can always come back, and any kind of aftercare is included, is for free. We work with 4 different brands. We work with Nobel, is a good brand. Stroman, MIS, and Dio is a good brand.
All our procedures have warranty, lifetime warranty. Why? Because I know that I'm using good quality materials, good glass, and I have a team that it might look young, but they have a lot of experience. It's doctors that they do 5 implants a day, not 5 implants a month.
Our driver can just cross the border, pick you up on the San Diego International Airport, bring you to the office, and also that could be a round trip, just take you there to the airport, like the most convenient. And the distance between the border or the gate to our office is just 3 minutes distance walking.
It's preferable to have a valid passport, but if you don't have it, you don't have to worry. As long as you have a valid photo ID, you can get to the border. We also offer medical pass, which has a cost of $25 for the patient of the clinic, and it's a very fast way to get back to the US. Medical pass is like a government permit, so you have just keep the line at the border and you go straight to the US.
It's a very safe area where you can walk around. There's a Starbucks across the street. You will see Domino's here. Everyone speaks English. Everything will be translated in a way that you can understand it for your explanation, to answer your doubts, and to give you all the information required.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.